just going back to some of the work which we have done around ASIN, and going back to one of the key points which you have mentioned around, which is the disaster management. In the city of Surat, as you may know, that the city is prone to floods, especially due to Tapi, and in '94 there was a huge plague which led to a huge amount of people evacuating the city. So as a part of the program, ASIN program, we have been working with the city for close to 7 years now. And one of the things which we came up, two things which we came up. One is towards development of an end-to-end early warning system. And the second one is a public health system, a disease surveillance system with an, which will provide warning in case of an epidemic. And both the systems are run and monitored by the city authority. But the interesting thing is, going back to your question, the partnership which the city has forged is with 14 institutions, ranging from the national institutions such as IMD, the regional institutions such as CWC, and also with the state institutions such as Gujarat State Disaster Management Authority, the irrigation department, because the dam management is a complex issue, because the irrigation department wants to hold as much water as they want so that they can cater to the people during the summer times, especially the farmers. And for the city, during the tail end of the monsoon, when the dam is almost full and there is an extreme event, and they had to release the water within a 6-hour notice period, and that affects the city at large. So going back to the discussion of resilience and a smart city, what Surat did was, they can control only within the city boundary limit. But an interesting thing which they brought about was they formed a trust which is called Surat Climate Change Trust. They brought together all these 14 institutions and they started having a dialogue. They started having discussions. And of course the technology was brought in terms of providing a warning system, but the technology existed. It is the data sharing mechanism. It is also the decision-taking mechanism. Because at the time when the Surat city comes to know there is going to be an extreme rainfall 48 hours down the line, it is not the city which needs to act. It is the irrigation department which needs to slowly release the water supply. The second thing which is once again interesting for the city of Surat is the public health system. Post that plague, they have quite an important, they realize that health is a very important part of it. And for business continuity, because most of the people who are working in the diamond industry did leave the city post 1994. And it took industry some 1 to 2 years to get back those trained laborers and the city to get back to normalcy. And again, the same thing happened in 2006 during the flood. 70% of the city was flooded. So what they now did as a part of the ASIN program is they said that disease surveillance is something which they are doing on a regular basis. But the paper-based system, it takes around 14 days for them to collect it from every hospital and also respond to it. So as a part of a resilience mechanism, right now 470 hospitals, both within the city and the periphery of the city, are connected right now, and they are providing information through computers and mobile phones on a daily basis. So in both the cases, the administrative authorities are functioning in a regular manner, but what they are doing in addition to that is trying to bring the dialogue or taking the dialogue to a larger stakeholder list. And having the dialogue with the larger stakeholder, people are willing to cooperate. And the resilience in both the cases is not about by preventing flood per se. Probably tomorrow there is an 400 mm rainfall within the city will be flooded, irrespective of the dam authority. But it is an ability to take action 48 hours or 72 hours before, so that people are not in panic. The chaos doesn't arise during the event. And post-event, people feel that they have been informed that something, plague is going to come up, or some kind of a disease is prevailing. So there is nothing to worry about. The municipality is acting on it. Such kind of soothing mechanism in terms of information sharing and by bringing multiple people will encourage. Thank you.